Tattooing, intradermal introduction of insoluble opaque pigments to correct color defects of skin, including micropigmentation, 6.0 SQcm or less. 6.1 to 20.0 SQcm. Each additional 20.0 SQcm, or part thereof. A marking pen is used first to outline the area to be tattooed. The dye, insoluble opaque pigment, is injected into the skin with a pneumatic tattooing instrument to create an artificially pigmented area that approximates the appearance of normal skin tissue. Subcutaneous injection of filling material, e.g., collagen, 1 cubic centimeter or less. 1.1 to 5 cubic centimeters. 5.1 to 10 cubic centimeters. Over 10 cubic centimeters. Physician uses a syringe to inject the selected material into the dermis of the skin. Injection, intralesional, up to and including 7 lesions. More than 7 lesions. The physician uses a syringe to inject a pharmacologic agent. Insertion of tissue expander, S, for other than breast, including subsequent expansion. The physician uses a tissue expander to stretch skin and soft tissue prior to definitive reconstruction on tissue other than breast. These expanders are balloon-type devices that stretch the skin and enhance epithelial and collagen expansion and reduce or eliminate the need for skin grafts during reconstruction. The physician makes an incision into the skin. The subcutaneous layer is identified. Blunt dissection is used to separate the skin and subcutaneous layers. The tissue expander is placed into the prepared site. The wound is sutured. The expander is inflated. During the post-operative visits, greater volume is placed into the expander, stretching the skin. The expander remains in place until the final reconstruction is performed. Replacement of tissue expander with permanent prosthesis. The tissue expander is deflated. The physician uses a scalpel to make an incision. Blunt dissection is used to remove the tissue expander. The permanent prosthesis is placed into the recipient bed. The prosthesis may be an autologous graft or commercially prepared synthetic material. The graft prosthesis may require stabilization with sutures, wires, or screws. The incision is closed with sutures. Removal of tissue expander, S, without insertion of prosthesis. Initially, the tissue expander is deflated. The physician uses a scalpel to make an incision. Blunt dissection is used to remove the tissue expander. A surgical drain may be placed in the wound. The incision is closed with sutures.